Trying to find a hotel that accept $120.
Yeah, well, nobody will accept $125. That's the problem.
No, they don't.
Yeah, the only one I saw was that one down here, right where you get off I-65. The lounge is called the Barrister. You can stay there for $125. But you need to carry your own.
Where?
You need to carry your own roach box.
Yeah, and you want your own sheets too.
Yeah. Well, those sheets ain't been on there but a month. They're relatively new.
That's so gross.
It is, isn't it?
New rubber, you hose them off.
It's one of those Intel dust suits.
Okay.
We're waiting on Dr. Tom.
Okay, just we need to get it back on.
Do you want to?
Oh, let's wait till Dr. Talbot gets here, because I might make a joke or something. The board is now back in session, and we are down on the list to the governor's office email I received. And I actually talked directly to the governor about this, and they're not going to approve Clint Mays, period. And until his firm has no litigation involving the state. So it ain't going to happen. So at this point, I'm going to make a motion that we move Don up to general counsel, and that we ask Cameron if he will continue to be our disciplinary attorney, DA, from now on. Do I hear a second?
A second.
Dr. White seconds. Any discussion?
Mr. Cameron, do you accept that?
It'd be subject to that agency's.
Right. The AG will have to, the civil division has to say that's okay, right?
Yeah, that's
Okay.
Nothing against you, Cameron, but saying from now on, I might say.
Oh, no. I shouldn't have said,
He'd be 80 years old, still be working here.
excuse me. My motion meant,
For the foreseeable future.
for the foreseeable future. Okay. So we have a motion and a second. Let's call the question. Dr. White?
So, Dr. White,
Have
yes.
we, one quick.
Okay, I'm sorry.
Have we reached out to Don to see if he's,
He did mention that he was interested.
he's still interested? He hadn't taken
All
another
right.
position.
All
so-
right.
Okay, all right.
All right.
All right.
Dr. McElwain, yes?
Great, yes.
Yes?
York, yes.
Yes? Bishop?
Yes.
Talbot, yes. Terry, yes.
All right, so we've handled that little piece of business. All right, I've turned the page. Reports, President's report. In your package, you see that there is a State Committee on Public Health report. Looks like oysters are good to eat. Okay, that's all I got to say about that. Executive Director's report.
Good afternoon. I guess it's way past morning. We'll start with the sunset audit. We started the sunset audit. A lady by the name of Charlene Martin came on January 22nd. We had the engagement meeting with myself and Mary Beth. She came on board came on site the week of January 4th, was here for 4 of the 5 days, gathering information, interviewing everyone. Everyone is engaged in this, so people are responding. We are reviewing things as we're handing it over. It's not just a matter of, can you give us a piece of paper? Kevin had to work 3 days to literally put together one document for her for the ease of her to see it. So it's good relationship. She's been really good to work with, and things are moving on. We do not have any answers yet, and we will not for a while. CE Broker, we performed the audit, and that happened on January 20th and 21st. We had one person that did not pass the audit out of 50. That was a hygienist. And she thought she had done everything right. There was a 5-hour HIPAA class. She thought she got 5 hours of credit. It was only credited for 4, so she ended up with 1 less hour than what was required. We sent the fail letters out, or the fail letter, and then it's moving to Kevin to put a case together for the one that did not pass.
Sharon, and what y'all assisted some of the ones that fell out because they did have completion, they just had it wrongly put into the CE broker.
Yes, that is correct. We had 4, including the one that I commented about, and we reached out to all 4 of them. And of the 3 of them struggled with how to use the tool. One of them had not used the tool the first year correctly, but by the second year, she was using it perfectly. So that was easy. So yes, 3 had the correct hours that they needed to have. iGov to Lumen migration, that has been going on since last summer. So the first week that I was here, Mary Beth and I met with our Lumen and discussed, number one, they did not have any type of reporting to provide to us. It was just a verbal report. They knew that they were dragging in it, that it had been going on for a while. So they deployed 3 additional resources to try to get this going again. We asked for proper reporting, proper project management reporting. We asked for the estimated completion date. They did not have it. They've not committed to us yet that date. They did make the comment that they felt it may go to the end of the year, which I think is interesting. So I'm waiting for them to finish the scoping out that project, and then we can look to determine if it makes sense on the ECD that they give us. Second week I was here, I met one-on-one with all the staff. We reviewed job descriptions. We reviewed what can I do to help them in their day-to-day job. We did have one staff member that has some capacity, so she was not being utilized all day. We immediately started moving functions to her to own moving forward. And then she was actually the one that did the audit and did an excellent job of doing the audit. And she is now working with Gina and doing some ADHP activities because the class, the instructor class on Sunday, you've got to come out, you've got to update all the iGov accounts, you've got to get everyone their certificates. Well, Gina's in the middle of a class, that probably wouldn't happen for another month. We got Ellie to do that. Ellie's doing a great job, so we're giving her more work and responsibilities, and she's responding well. Comp time, we've already talked somewhat about comp time. Comp time is excessive in Mr. Driscoll's words. I think he used the term 3 times what had been the historical average. So I ask that everyone gets their comp time pre-approved before it's worked. And then it gives me also the opportunity to move functions if we need to and not have to work that much comp time. So we're working that comp time. We've got a timekeeping system, QuickBooks, that we're going to be implementing for the ease of tracking comp time and tracking hours. There had to be 2 audits before the sunset audit started to make sure the timesheets were correct because they are so manual. We're not on the e-state system like all the other boards are. If we were, it would be easy and it would take care of it for us. But we will be implementing QuickBooks in the next few months. And then the last thing is that Shannon is now responsible for property management. That got transitioned about 2 weeks ago. So that's part of his responsibility and role as well.
Okay. Thank you. I would like to make the recommendation at this time that since we have so many important things to get done between now and sunset, that we move Sharon from part-time ED to full-time ED in that period. So that we can get this done in a timely fashion, and she's got lots of work to do. And I anticipate that being about the next 6 months. Yes, Dr. Finn?
Still interim ED or just ED?
interim,
Can
I think. Yeah.
What do we need to say, Dr. Finn? Help me.
I mean, we could say full-time interim.
Full-time interim. Okay. That's the motion that I present. Do I have a second?
Second.
Second by Dr. Gray. All in favor? Passes by unanimous consent. All right, and I think we've got the team together now, getting things done, and we're pulling things off. So I feel much better about it.
I do have a question.
Yes, ma'am.
In the past, we had some employees work remotely. Are any of the board employees working remotely?
And not today.
No, but I understand that we have given the disciplinary part of this the leeway of working as they need to from where they need to get things done. Cameron's in Montgomery a lot, aren't you, Cameron? And I think you and Kevin sometimes work together outside of normal function. So we're going to leave disciplinary alone and let them keep getting the job done as they can. So if time is different, go ahead.
So yeah, I think you may be touching on, we don't have any full-time employees that are on a salary that aren't physically here, but the only ones that are not here are contracted hourly. Is that correct? Is that what we're saying?
No,
That's not true.
He was talking about Kevin.
I'm talking about Kevin, that we always have given disciplinary the okay to like.
Okay,
like
I thought you were talking about Cameron.
no,
Okay.
well, Cameron works from Montgomery a good bit,
Yes,
and then Kevin interfaces with him for us,
right.
and so
Right.
we've always given disciplinary the leeway of. I didn't care if they were in this building or not, as long as they got my job done.
Okay.
And that's where we are still.
Yeah, so the two of them, not necessarily in this building. Okay.
Right. That's the whole point I'm making.
Okay.
And I did a lousy job
Well,
explaining.
No, it's fine. I got the
Okay.
names mixed up.
All right.
Cameron, Kevin.
So we've eliminated everything in special reports. We've already done that. We're down to board member reports now. And I'm the first one up, IV assistant. What I would like to propose to the board is that we make a rule change and add to assistant's duties that permit holders for parenteral sedation and general anesthesia, since they're required to be able to start an IV, that they be able to train assistants under direct supervision to place IVs and train them to competency. Yes.
My first question for clarification, is that a new subcategory of professional or is that a general assistant?
That's a general assistant.
Which means that would become a hygiene duty too. 310 states that all duties of allied personnel start at the top and then it relegates.
If you had if they had a hygienist, they could train them. And yes, Kevin, that's correct. I mean, we train Connie in starting IVs, but she's a little squeamish. Yes. I just think this is something we ought to do, because the problem is in the past, we had lots of RNs that you could get to work in offices, and you can't get them anymore. They become prohibitively expensive, and the number of them has dropped down a lot. And I'd like to bring that as a motion to the board.
Matt, I don't know if this is the appropriate time, but assistants can't place whitening agents. If you're changing assistants issues, could that be something that's looked at?
Added to the list in the rules.
Yeah.
What do y'all think?
Whitening,
Let that be
it's
I agree
under
with that.
direct supervision, but it's kind of silly.
I agree. I think it needs to be a board rule that we just amend.
Yeah, like if you're going to change assistants, change, job responsibilities for assistants. I'm just trying to throw it in there. Let's do 2.
Application of whitening agents by assistants, we add that to the list of things assistants can do.
Yes.
That'd be a second motion.
As long as it's done under the supervision of the dentist.
Under the direct supervision of the dentist.
Yes.
Okay. I mean, does anybody have a problem with that?
I've just got one comment. Just for discussion, I'm not against it, but I think we all need to recognize that when you use these very high-level hydrogen peroxide bleach materials and you let it get on the gingiva, you can really, really do some damage in just a ultra short period of time. So that's the one thing, that's just kind of the one caveat I want all those that have never performed in-office bleaching to realize before you vote for this, is because you let this 30% stuff get on your gums, it will not burn them off, but whatever's just before that.
Oh, it'll blister them and pickle them.
Yeah, absolutely.
I've seen
Yes.
those patients, they've come to me because they didn't have any gums.
Yes.
They're all burned all the way across.
Yeah.
Yeah.
And
All of a sudden, I became an expert.
Mark, I got a question.
Yes, sir, Dr. Piszczek.
Who's going to train these assistants? The
permit holder.
permit holder?
Yeah. They're responsible for training them to competency.
Well, there wouldn't be a permit. It would be the licensee.
Well, no,
Yeah,
see,
dentist.
but in what I was talking about for IVs, only people that have a
Oh.
general anesthesia
Okay.
or a parenteral sedation
No. Yeah.
would be used.
I was going back to whitening when you said.
Yeah,
permit.
no.
We're talking to, okay.
Yeah,
That's fine.
yeah.
I get it.
Let's handle that first issue first. First issue first is the IV and understanding that assistants working with permit holders for assistants and hygienists working for permit holders with an IV sedation a parenteral sedation permit or a general anesthesia permit, that an assistant that has been trained to competency in IV starts can place IVs under the direct supervision of the permit holder.
Who maintains liability for that?
The permit holder. The permit holder does. So that's the motion that's on the floor. Do I have a second?
Second.
Dr. Holt seconds. And is there any further discussion? Okay. Roll call.
Dr. White, yes.
Dr. McElwain, yes.
Dr. Gray, yes.
Dr. York, yes.
Piszczek, yes.
Talbot, yes.
Harry, yes.
Okay, so this will be a rule change. Okay, now, we now have Dr. Talbot's motion on the floor about the application of whitening agents. Do I have a second?
Quick point of order.
Oh,
I
I'm
don't
sorry.
know that Ms. Perry can vote on that last one.
Okay, well,
Well, it said anti-hygienist.
Did it?
Yes.
Well, then by all means vote.
what's, sorry?
She said it said and hygienist. We should,
Well, hygienist, yeah.
then by
So
all means.
I have
I
a
just wanted to
question.
make sure
Are
we got it, the vote right. That's
Are
all.
we actually trying to implement this, or are we just doing research on?
No, this is gonna be a rule change.
Oh, wow. Maybe we should get, Alda and,
About the IV stars?
No,
About the bleaching?
yes.
We're not on that yet.
Well,
Yeah.
let's,
We're getting there.
first, we got a motion. We have to
Okay.
get a second, then we have a discussion.
Okay, sorry.
Okay. All right, you want a second?
I second.
Okay. We have a motion and a second. Now, go ahead.
I think we should probably get more participation from the dentists in the state, including the organized dentistry. I think you might did you want to say something?
I was just gonna ask, so if you approve to move forward with it, you have to have a public comment period.
Right,
Yes. They'll write the rule
right.
and then we'll adopt the rule and then that will be published. And then once it's published, we have a public comment and then it'll come back to us. And within 45 days of when we approve it, it'll become
Or it gets revised and then goes. to another
revised and we'll have to start again.
Right.
Okay?
If I could just draw your attention back to the joint committee in our agreement to discuss proposed rule changes or statute changes before they're brought before the board.
That's exactly why I was
Okay.
mentioning that.
Well, then, let's,
How about before adopting the rule, we have a joint committee session?
yeah, so let's modify that motion, Dr. Talbot, that we have a joint committee discussion about the adoption of assistants being allowed to apply whitening agents. And we have a motion and we still have a second. Does that sound reasonable to y'all?
Stay consistent, wouldn't it be about both?
About the IV starts?
Not saying that we would be opposed to it.
Yeah, well, I'm not real sure
Where that,
why general dentistry would be concerned about IV starts, and it would just delay that from being implemented, because the problem that the nursing shortage is acute, and doctors are having a hard time finding people to help them. And I've had like 10 different people call me and say, help us. I like to move that along.
My concern is not about the subject matter, but more about precedent.
Well, we'll follow the protocol from here on out.
I mean, you know, I don't anticipate any issue with IVs.
Yeah, but Michelle, my problem is if we go joint committee on that particular issue, it may be another 3 months before it's back before us. And it's not something that is going to affect but a limited number of people. I would say less than 100 permit holders in our whole state. And I'm just trying to give the people some relief. And I understand that other issue, it affects everybody. And we're not setting a new precedent. I'm just trying to move something along with a little efficiency.
Understood, just so.
I understand, and I take note of your complaint.
Just so
Okay.
we're on the same page, that we're
Yes, ma'am.
not gonna come up with new things.
We're not. You're not. You'll get rid of me in October of 27. All
what
right,
you think?
you think? Yeah, okay. Mr. Lane.
We still have to do the background check for the whitening lawsuit too. Whenever you have discussion about legislation or rule change for whitenings.
Okay.
Just ignore what I said, like,
Well-
just pull it on. And I don't know the
You
history,
don't need to, I can do the background. and
But I
then
mean,
you
I don't.
Well,
I was thinking,
but-
I mean, I apparently do not use whitening agents that burn the gum tissues to the bone.
You're just so good you didn't realize that.
I don't need to.
Generally, people that use 30% peroxide, like Dr. York, are intended to make explosive devices. And the ATF will be to see you this afternoon, buddy.
I'm out.
Okay, I would like, Kevin, you do your work. Dr. Talbot's got a good idea. The joint committee will consider it and then bring it back to us. Okay? I think that's reasonable. All right? Dr. Talbot, there's nothing wrong with that. I think that's something to study. Okay. Dr. Gray, you're up.
All right.
Ethics comments and PPO.
So,
Maybe finish the voting, or we're gonna just set the voting out.
Oh, well, we're not adopting it. We're just submitting it for study.
We have a motion and a second.
Okay, all in favor? Unanimous consent. I'm sorry, Dr. Fan.
okay, I'm up.
It's my blood sugar.
Okay, so I've got two things here. One, we heard a comment earlier that directed us back to the March of 2024 minutes, and I would encourage each one of y'all to read that, because in the executive director's report, there's a fairly lengthy paragraph about statements made in my behavior as a board member relative to ethics and ethical behavior. Subsequently, multiple complaints were filed mid-2025 against me to the Alabama State Ethics Commission, several of which were very similar in nature and essentially the same set of circumstances that are in that executive director's report in March of 2024 minutes. So did an interview with the State Ethics Commission as part of their formal investigation, presented all the facts that I had, and I'm happy to report, and we'll put this on the record, that the complaints filed against me, I'm just going to read this directly from the Ethics Commission. Complaints filed against Dr. Jordan Holt Gray alleging that he may have violated the Alabama Ethics Act. The complaints have been investigated by the commission investigator. The results of those investigations were presented to the members of the Alabama Ethics Commission at their meeting held in February of 2026. The commission concluded upon review of the evidence from the investigations that there was no probable cause to believe that Dr. Gray violated the Alabama ethics law. Accordingly, the complaints have been dismissed.
Okay.
So
that letter should be part of the minutes.
yes, and what I would like to also
Appropriately.
yes, the other thing I'd like to for y'all's consideration is to amend or at least make an addendum to the March of 2024 minutes that are related to this matter that would direct anybody reading that portion to this resolution. Is that doable?
We're in the middle of them reviewing all of our minutes for the sunset. I don't
Okay.
make it right this second.
Okay.
What do you think?
Well, my concern is that somebody would read the minutes and the report given in March and not know the outcome and therefore be left with an improper perception of what transpired.
I'm just trying to look at timing and not get them all confused.
I just never.
Could we, in the current minutes, we can say that this letter addresses the March 2024 minutes questions?
What about if we just put a note at the bottom of the minutes on the website saying, please refer to February 20th?
Yeah, I think that's a good.
There you go. That's what I'm like for consideration, along with this letter.
Not modify the minutes, but
That's
put a
right.
note. I like that, Dr.
That's
Finn.
fine. And then put this letter in the current minutes of this meeting.
Okay.
That's
like
my request. Do
right.
I have a motion?
So move. Second. Second. All in favor? Unanimous consent.
I abstain.
And Dr. Gray abstained. All right, PPO insurance.
So this came up once through public comment, and then it came up again at the town hall. No, it wasn't at the town hall. Well, yes, it was. It was several comments throughout the alumni weekend about the board looking at, and Cameron, you can probably help us out here, 3499. So I have printed off the statute because the case was being made that, you know, dentists were in violation of the Practice Act if they contracted with PPO insurances. And I was like, there's no, I mean, I was like, I got to look into this more because that just seemed to have such an impact on our entire profession.
It's that letter we got,
Yes.
a while
Yes.
back.
So I looked at it.
a letter.
That's right. So basically,
Did you get it?
I don't think so.
okay. So essentially, the case is being made, or at least for our consideration, that the 3499D2, and I'll read it to you in just a second, that part of the Alabama Dental Practice Act and statute precludes any dentist from legally being able to be contracted with a PPO insurance agency because it reads that no person other than a licensed dentist shall exercise control over any of the following, and one of them is policies and decisions relating to pricing, credit, refunds, warranties, advertising. Now, so the case was made that, well, that's controlling prices, but the rub on it is that the dentist is, relative to the statute, is voluntarily signing an agreement with a company, with a contracted insurance. So therefore, they are in compliance with this part about no other person other than a dentist pursuant to this chapter may exercise control over the following. Well, the dentist is the one exercising the control. And I just wanted to put that in clear. That's my interpretation, unless Cameron, I'm missing something.
I think you're right. I read that thing 4 times and I agree with you.
Okay.
The answer would be, you don't have to say yes.
No,
Okay.
you can always say no.
You can always say no,
I just wanted to address
Right.
that so that if it did come up again, we've
Yeah,
got,
there is no coercion or forcing you to do it.
You have the option.
Okay.
there you go. Okay,
All
thank you.
right.
That's all.
All right, thank you. Ms. Perry, you're up. DPA discussion, study of general supervision.
Okay, so in town hall, it came up about general supervision, and I just want to address that someone stated, Mississippi, they had spoken to a board member in Mississippi, which they had never done that. I too spoke to the hygiene representative, and she said they've had no increase in liabilities. They've had good success, and that the only thing that they regret is it being so restrictive.
Now, remind me, Mississippi has the thing where you can have 7 days of
24.
unsupervised, huh?
24 total.
Oh, 24?
24 total in the year, but 10 consecutive. They have to be sponsored by a dentist. A dentist can sponsor 3. There's a $25 fee for that sponsor.
And they can see patients without the dentist being
They
physically
can
present
see.
as long as
There's no comorbidities. They're not new.
no,
It is
no new
No new
patients.
patients. They are not new. They've had an exam within the last 7 months. They cannot be seen more than 2 times under that.
What about, does it
Temporary
mention
hygienists do
radiographs
not
if the
apply.
radiographs are made?
If they're prescribed before, he can read, or the dentist can read them after. That also came up of, well, what if they had an ulcer? Well, at that point, we could take a picture and say, could you tell me what this is? And when the dentist says that's an ulcer, then he could prescribe whatever at that point. I checked with Tennessee. They said they've been doing this so long that they don't keep statistics like that at the board. I could email public health. Same with Florida. They don't keep statistics like that anymore because they've been doing it for so long that public health.
And they're similar to 24 days?
Mississippi is the most restrictive state right now.
Oh.
That's,
What about Georgia?
I haven't looked into Georgia yet.
Most
It's on my
restricted
list.
state right now is Alabama.
Yeah. You tell me that every time, but you know what I mean.
We are.
Okay, so then Mississippi after us.
Yeah.
And I checked with liability, and it is, they would not have to have our own liability insurance. Some of us already do. If you're employed by the dentist, you're within the scope of what the board says you can do. You are covered under that dentist liability. That's all I have for supervision. You ready for
Okay.
me to move on?
Yes, ma'am.
Okay.
Now, let's see here. This is probably a good time, for Dr. York. Didn't we point out that, for Dr. Wright, that we already have in our rules and regs, that a hygienist can, what?
She's still got one more thing.
Oh, I'm sorry.
Totally.
I apologize.
Okay. Also at town hall, there was a dentist.
I'm sorry.
I tried to be quiet with my hay. Also at town hall, there was a dentist talking about the new assistant's duties. He then proceeded to say that they could not be filed under the dentist, the 1351, the sealant. I simply said, I'm so sorry, that's not correct. If they are under the board rule, they can do this. They are secondary providers, just like we are. They pay by code, not by the hands that do the work. I have a letter from Dr. Littleton from Blue Cross. I have one from Medicaid, which is Dr. Lockwood, and I have a letter from a mentor that is nationally and internationally known as an expert in coding. And they have all said the same thing. They are now secondary providers. There is nothing to do but to file it, just like you would file an
What's the
X-ray.
code do? I'm sorry.
It's a sealant.
Oh, for sealant.
Yes.
Okay.
So he has proceeded to now say that I needed to resign and that he wanted it by 5 o'clock of last week and that I am teaching dentists to commit fraud. I assure you, I'm not. I've given you a packet. I have an extra one. We are to file D1351 under the supervising dentist if an assistant does it. So I don't know how to handle this going forward. I would like for when he decides to come up in March or whenever that he be asked to give us the Blue Cross representative that he spoke to, because he called Blue Cross and told them that I was trying to get people to commit fraud as well. And I think that I should have the opportunity to call Blue Cross and set that straight.
So Blue Cross was contacted
Yes.
that you, a
Yes.
board member, are promoting fraud was
Yes.
the narrative?
And he recommends that the board immediately contact Blue Cross and let them know that y'all will totally handle fraud to the fullest extent.
Well, and each one of you received my reply
Yes.
to him, just stating that there are only these criteria for removing a board member: commission of a felony, an ethical violation of severe consequences, or the administrative procedure to impeach a board member, which is super onerous, and that I'm not really sure how a discussion of coronal polishing morphed into insurance fraud, and I would welcome him to come before the board and explain it to me.
I agree. I think that the damage he's done is done. He's called Blue Cross.
Yeah.
And we need to undo that.
Michelle?
I just had a question I was trying to understand. Did Blue Cross didn't tell him that that was not correct?
I cannot tell you if he's even spoken to Blue Cross. But I promise you, if he did, it took me 5 seconds to get an email. She answered me, and then she got a Blue Cross and answered us both. I don't know if he spoke to somebody at Provider Services who doesn't know, but we've got to do better with education.
My understanding, and correct me if I'm wrong, is that it was insinuated that he had already communicated with Blue Cross about that.
Yes. But
I don't know
he
what that
didn't
means.
say who to answer you. I don't know who he spoke to.
So just for clarification, he talked to Blue Cross Blue Shield before and after?
He says he did. He talked to them before town hall, supposedly said it couldn't be filed, and then he talked to them when he told them that I was asking dentists to commit fraud.
Well, if it makes you feel any better, well, that's my one.
I'm told I am now with the majority of the people, but fraud is pretty serious. Defamation is really serious, and I don't know if anybody's ever gone through an audit. I have, and they're welcome to do it, but it's time consuming. And
Yeah.
I just think that we need to be able to contact the person he spoke to at Blue Cross. I would like to educate them.
All right. Kelly, I apologize and welcome to the board. All right. Yeah. Let me tell you, you'll get used to harpoons in your back. That's what whales get, and I've got plenty. All right. Dr. York, I think Dr. Wright's issue is solved because that is already a board rule, correct?
Yes. Have you contacted him yet, or?
I will.
Okay.
You've got that. I don't need to worry about that.
All right.
Perfect.
Well, what was the issue and how was it resolved?
Polishing. Can you
The
polish?
high
It's already a board rule that says you can for a hygienist.
He actually had asked about.
A high speed or slow speed?
Not, he had asked about, he teaches apparently at Fortis hygiene. Hygiene is placing sealants, occlusion is high. Can they adjust the sealant if they stay off the enamel? And Dr. White found that absolutely they can. She found it in, I don't know if it was, I guess it was board rule. And so we just need to let Dr. White know. We're going to address that for him today.
So
but we
does
don't
it
even have to.
specify slow speed or high speed?
I don't think it does. I had someone ask me as
I
well.
think it just says adjust.
It does.
It does.
Okay, so we're gonna leave it at that?
Yes,
I can
ma'am.
Adjust with either a high or a slow, because I probably
Yeah,
need to make.
Adjust.
Okay.
We wouldn't even say high and slow.
High.
Okay. We have slain that category. Now let's move to unfinished business.
Oh, hang on.
What?
We've got continuing education.
Oh,
Hey,
God.
Mark, got your foot on the pedal.
I'm not gonna pump the brakes, buddy.
It's square dance night in Tuscumbia.
All right. Well, Connie and I got a date tonight, and I gotta get home, do my hair.
I know. All right, continuing education. So this past weekend, we had alumni weekend and talked to a lot of people, and then we had the town hall and heard from a lot of people. But the question was asked, I was asked multiple times, why is the board looking to possibly change the CE requirements from in-person to allow live online to count the same? And there's really two reasons, but it really initiated from the licensees requesting us to look at this. That's reason number one. The second reason, after looking into it, I presented in December 2024 to the board that at that time, there were 34 states of the U.S. allowing live online to be the same as live in person. I told the board that I felt this would change quickly as more states moved toward this. And when I did a similar presentation last fall, just maybe 10 months later, I then told the board there weren't 34 states allowing that. There's now 46. When I say 46 and 34, that also includes DC. So that's out of 51, not 50. So after the town hall this past weekend, I decided to do a little more research on several issues brought to our attention. And I further decided to call the other 4 state boards of Utah, Georgia, Louisiana, and West Virginia, who also have not allowed live online to count the same as live in person. So I got a hold of Utah, Georgia, and Louisiana. West Virginia, they must be in the state. I don't know. I never got an answer. I called 3 times yesterday. But what I learned is that number 46 is wrong. Utah and Louisiana now, just within the last however much time, now also allows live online to be the same as live in person. So that leaves Alabama, Georgia, and West Virginia as the only 3 out of 51. So there's 77 coded dental schools in the U.S., according to what I think to be correct. There's 4 coded schools in the states that do not allow live online to count the same as live in person. So 94.5% of the U.S. population are under state boards that have CODA-approved dental schools in their state who allow live online to be the same as live in person. 94.5% of patients, since we're talking about patient safety. Later today, let's see. So we've heard, you've heard, and we talked about this before. I'm not gonna dwell on this, but we've heard people say things like stress, mental health issues, camaraderie, attention while online. And I've still got the articles, from all this stuff. For every point, for every peer-reviewed article where these things are an issue, I have a peer-reviewed article where there's a counter issue of that. I mean, that brought the opposite. So, I said back then, really, that when it comes to research, peer-reviewed research on this, you can argue one side or another all day long on everything. So the opinions from these research really becomes a moot point. There's really nothing there that from peer review that you could just say, hey, this is the one and only way. We've got to have a bipartisan view in this and quit just taking one side. Let's look at both sides. That's what our job is. So also too, I heard some concerns this past weekend from UAB about attendance to their own campus in-person CE. We were told that that money is used as supplements for the instructor salaries. To me, that's a financial conflict of interest. I mean, we're talking all of a sudden we've tied CE to money that, and by DPA, we're not supposed to, UAB cannot have a person on the board anyway. That bothers me. That argument bothered me. So we also were told that in-person meetings would go away if online CE happens. And we were told that patient safety would suffer due to the mental health decline of dentists who don't go to in-person meetings and only do live CE. So once again, I decided to do more research, and I contacted 13 dental schools across the Southeast. I tried to keep it close to home. I don't yet have responses from all of them, but I do some because I only sent out the request for information Wednesday afternoon. With very limited information at this time, the response that I have from these universities are they have had no real change in attendance numbers for university in-person continuing education. I plan to contact other universities and continue to wait for responses from the ones I've already contacted. That addresses somewhat the concerns raised about UAB's in-person CE attendance in the future. So also yesterday, I started thinking patient safety. So I thought, I didn't get that many responses back from Wednesday. I just need to pick up the phone. And I started calling dental boards across the country. And my question was I asked them two things. Number one, because we had been told that some people were looking to reverse course and go back to in-person from live online. And number two, have you seen any change in patient safety issues or patient complaints concerning patient safety? The answer to both of these 100% of the time was they are not planning on reversing course and they are not having any increased patient safety issues. Also, too, we had one of the dentists in our combined ALDA meeting. He was talking about AGD, and I got to talking about CE broker, and he said, "Can we not just submit our AGD transcript online?" And I thought, I know this guy very well, and here he is when he uses AGD transcripts. He's an AGD advocate, and AGD's definition says right there in the middle of it that live online counts exactly the same as live in person. So he's an advocate for AGD on one side, but not on the other of this. That's okay. Everybody has their opinion. Also, too, we heard this morning that the ADA had unanimous resolution about in-person stuff, but from their brand new 2026 ADA CERP standards, which you can find online, and at the bottom, there's a phone number to ADA CERP, and I actually called and talked to the person, and this was confirmed. Live course activity is continuing education courses where participants must attend, whether in person or virtually, in order to claim credit. That's from the ADA. The same ADA that we just heard had unanimously passed the in-person resolution. So a little bit of a conflict there, not sure what's going on with that. But while ADA CERP definition treats live online CE live online CE, live in person CE, it also says at the bottom of ADA CERP, each state dental board makes its own rules about what CE formats they accept for licensure renewal. And while 48 states exactly mirror ADA CERP, we're one of 3 that doesn't. So this morning also, we were told that there could be lower success rates for live online CE. So I want to read a couple of quotes to you. So here's one quote from a peer-reviewed article that says, higher global satisfaction scores were found for students in the blended learning compared to traditional learning group, blended being live online. Also another quote from an article, increase in knowledge score of live online is comparable to that observed in the traditional learning group. Another quote from another article, learning during online mode of teaching had reduced anxiety levels and participants performed comparatively better. Another quote, online problem-based learning was identified to be equally effective as traditional problem-based learning. One final quote here. Supportive professional development. Actually, let me summarize this. This last article was about, this article is evidence about stress during emergency implementation, not evidence that online learning is inherently inferior. So these articles I've quoted right here that all have these quotes in there for online CE come exactly from articles sent to me from UAB in support of in-person only. So inside of the same article, it is advocating for online CE. or it says it's just as good. It's not advocating for it. It says it's just as good. So, you got to be real. You can't just read the first couple paragraphs of the research article and read the conclusion. You've got to read the whole thing. Wise man told me that one time. And so, so inside of these articles that we were told to ask for, and we would see why we need to stay in person, it says increase in knowledge score is comparable to that observed in traditional learning groups. So that argument to me goes out the window too. As far as, we heard too the other day in the combined board meeting from UAB that instructors do not like putting on online continuing education because it's stressful. I have found several articles where it actually states that, but that was within 1 year of COVID, because these people were forced to do live online. They weren't prepared for it, and that model has now changed. So if there's one statement that kind of combines all four of these articles, it would be this. Evidence does not support the claim that live online education is inferior to in-person education. These are from the UAB articles. In dental education, blended and online formats can produce comparable knowledge gains and similar objective clinical outcomes, and in some domains show improved satisfaction and longer-term progress. Differences between online and in-person formats often relate more to design, structure, and interaction more than the quality, more than the delivery medium itself. So it's got to do with the way it's structured, not the way it's presented, not by what it's presented. Another thing I found interesting is we were given this morning from an ADA person, and if you look at the 6 out of the first articles that's referenced, every one of them say during the COVID-19 pandemic. So, those articles were written since then, but it was research on during the COVID-19 pandemic. So I'm going to put this over here with this other stuff. So kind of lastly, as we move forward through this, here's what I think. That there's a lot of people out there that think that we should do it online, and there's a lot of people out there that think we probably shouldn't. And I was, the other day I was told at the meeting, I was asked, because I'd said the majority of people I've talked to were wanting live online CE. And then we get to the town hall, and it wasn't almost unanimous. It was unanimous. It was very unanimous. Everybody in there wanted to keep it in person. And I was asked, where are all these people at now? And I said, well, you do realize we're talking about in-person CE at an in-person event. So we're preaching to the choir. And if we'd have done an online town hall right after an online CE event, every one of those people would have advocated for live online. So let's be respectful. I mean, let's try to look at both sides of this thing, because everybody has a license. Everybody needs to be heard. And so what I'm proposing is that we survey all licensees in the state of Alabama. And I think we should give them options to choose from. I've already talked to Mary Beth. And I think what we need to do is maybe send this out through SurveyMonkey and try to get it back within the next month and discuss the numbers.
So Dr. York, you'd like to put a motion on the floor to conduct a survey? The survey.
Yeah, I was going to do that when I finish.
Oh, I'm sorry.
You're okay. No, you're fine. You're fine. So for these things, kind of what I wanted to do is give them options. Give them options to think about. And you know what? There may be more choices than these 4 that I put on here for dentists, or more than the 3 for the hygienist. But just so that everybody online can see what I have in my hands right here that I've written, option 1 would be, I think we should maintain 20 CE hours annually with a minimum of 10 hours coming from live in person, then the other 10 hours can be achieved by any other method. Choice 2, I think we should stay with 20 CE hours annually, but decrease the number of in-person hours from 10 to 8 so that all in-person requirements may be completed in one day if desired, because there is an 8-hour per day max on continuing education. The other 12 hours can be achieved by any other method. Option 3, I think we should allow live online. The CE participant can interact with the CE presenter to be the same as live in person to fulfill the 20 hours per year requirement. Option 4, I think we should allow any modality of CE to achieve the 20 hours per year requirement. I told this board almost a year and a half ago, there was 34 states that had already gone to live online, and I expected it to increase. Right now, there are 20 states that allow any modality. Once again, I'll tell you, I expect that to increase. That's the next move. For hygiene, the answers mimic everything, except they do not have an option of going from 10 to 8, because theirs is 12, so they would have basically the same options of choice that the dentist would have. Lastly, once again, I just encourage whether you think live online is for you or live in person is for you, let's be respectful. Let's not look down our noses at the other person with a differing opinion, because last weekend I had someone who I respect greatly come up to me, and they were a huge advocate for in person, and they said to me, sometimes we just have to protect people from themselves. This is a very self-righteous, judgmental statement, when in essence, what you're really saying is you're smarter than someone else when it comes to what they need, and you are assuming you are right and everyone else is wrong. And when you start deciding what's best for everyone else, you can justify just about anything. I want us to be very respectful of each other's opinion on this CE issue, because right now there's 48 other states looking down their nose at Alabama and Georgia and West Virginia, and they're saying, you know, sometimes we just need to protect these other states from themselves. So with that, I would like to make a motion that we survey both dentists and hygienists to see what they think about live online CE versus in-person, and maybe even altering the number of in-person hours, just to see where we're at.
So move.
I have just a comment. Well, maybe.
Well, first,
Yeah.
we have a motion, and you want a second, and then we'll talk? Okay, I'll go ahead.
Yeah. My first thought is, how do we ensure that 10 to 15 years from now that we're doing things the right way? And what I mean by that is, if we are, for lack of a better word, pigeoning ourselves or putting ourselves in one category and saying, hey, it's got to be live and it's got to be live online and it's got to be online. Why do we have to designate how it has to be? Does anybody?
So you're kind of advocating
You're advocating option 4.
no modality.
Yes.
Yeah.
Why? Because we'll keep going over this issue. Why does it have to be designated? It's got to be live online, because you're right. There are people, the community is good. I frankly, I don't think we should associate mental health to, that's too much pressure to say, okay, well, if you're not in live classes, then your mental health will suffer. That should be in an entirely different conversation. I don't think that should be included at all. But saying that, I recognize that there are people who enjoy community. I'm one of those people. Maybe you don't know it, but I like being around other people.
Yeah.
But to just have it where it's a mandate that, hey, it has to be this way, I think we are putting ourselves in a box. And we're already trying to come out of a box on other issues.
I agree.
Dr. White, one of the reasons we have the 10 hours is previous boards were very reluctant to accept that online was equivalent to in person. And historically, there was only one kind of CE that counted, and that was you had to be in a lecture room getting a lecture. And when modifications were made to allow for online, it was considered inferior. But that was 20 years ago. All right, now, the only people I've had contact me in favor of the hybrid, the mixed, where you like Zoom, where you can interact with the lecture, are younger people, the 25 to 40-year-old group of people. And I've had maybe a dozen over the last 2 or 3 years. But the interesting thing is I got thinking back about it. I've never seen any of them at Gulf Coast Dental Conference, at an ALDA meeting, period, or at alumni. So they don't participate in it at all. And I'm really curious how in the hell they get their 10 hours. But I never thought about it till now. Now, I agree that things are going to change because that group of people is going to age up, new ones going to be added, and they're technologically savvy. I mean, look, I'm doing good to use a cell phone. And my children set it up for me and do everything. But that's changing. I'm 70 years old, and I may be thinking old. I love a lecture. I love to give a lecture. I love to interact and say things and get up there and act up and everything and get a rise out of people and make them ask me questions and put up provocative slides and stuff. I think people learn from that. I think they really do. Now, that isn't saying that I haven't given a number of Zoom lectures that have been all over the country and used, and people loved them and liked them a lot. But I get something out of giving a lecture and being there with the people and watching the people. I mean, it may be ego gratification. Hell, I don't know. But I dang sure enjoy it. One thing I'm going to say is that I definitely agree that a survey is the proper next venue. Second thing I'm going to say is ALDA is engaged in a great fight right now. And that fight is for the heart and soul of dentistry, because if we continue in the state of Alabama with PPOs like we have, and we're not remunerated fairly, and that's what dental loss ratio is about, they're choking dentistry out, because each year we have fewer and fewer kids stay here to practice dentistry. So I'd like to suggest to the board that we leave this topic on the table, but that for the time being, ALDA is actively engaged in a very important fight, and I don't want to do anything to detract from that fight. And I'm not saying that the topic's right or wrong. I'm saying that this is the wrong time for a distraction.
I agree.
And I think maybe we could all come to a consensus and agree about that.
Yes.
Okay?
Mark,
Yes, Dr. Piszczek.
I think we also need to start looking about the annual requirements of the CEs, like infection control every year. I think we need to decide about.
Y'all know how I feel about that. I think requirements are wrong. I think that if you're a professional person with a license, there shouldn't be a requirement for infection control, opiates, or ethics, or any dang thing. You ought to be able to use your 20 hours that educates you the best to take care of your patients and not have those requirements.
I agree with that.
We did the infection control when AIDS was wide open, and we all went crazy thinking that everybody was going to get AIDS, and we forgot that universal precautions prevented hepatitis, and it dang sure worked for AIDS. So we did that. Then the governor came along, and they were fussing and mussing about opiates, and we had to have something to make her happy. I don't remember if it was her or him. It's been so many years ago I did it. and we put the opiate requirement in. And then we did the ethics requirement, thinking that all these people we see that are so unethical, maybe that would change them. Well, no. We should get back to what I keep telling y'all, and that is we ought to do away with these requirements. We ought to give them 20 hours, and at the current time, it's 10 online, 10 in person, and we ought to let them sign a dead gum place that says, I did my hours, and trust them as professionals. And if you want to use CE Zoom or Zoom CE or CE or whatever the hell it is, CE Broker, if you want to use that, then that's fine to use it because I think it really is an easy format and I like it for that. But I don't think we should require anybody to use a proprietary technology. But I think that the cost of that is it makes auditing them really difficult and creates a lot more work for your staff, which our staff is fairly well taxed with all the things I keep telling them to do. So though I find it onerous to have CE Zoom be something we require people to do, I'm not really sure that for the efficiency of the audit and for the integrity of continuing education, that it's necessarily wrong.
You said mean CE Broker?
CE Broker, what'd I say, CE Zoom?
Yeah.
Yeah, well, you know, I first time I saw CE Zoom, I thought it was a whitening agent.
I'm not opposed to keeping CE Broker. I mean, I think Dr. Finn and the previous board did a really good job of kind of getting everybody signed up, and that takes a lot of work. And it is something that can be leveraged now to make y'all's job more efficient and easier in an audit. I do have a problem with the CE Broker having the ability over a licensee to be able to renew their license. I think that's holding their livelihood, using and kind of weaponizing is not the right word, but it's just holding hostage their ability to renew their license under a third party that's not affiliated with this board and is a for-profit organization. I have a problem with that.
That's the problem.
That's the problem.
See,
Was a board requirement.
I know. What I'm saying is I want to reverse
when
that.
it was done, when they promptly got me to graduate off the board and I had opposed it and opposed it and opposed it.
Then they passed
It
it.
got voted in.
And how he
It
came
got
back
voted
into it.
in, and that requirement got added.
That's right. And a bunch of people got audited in the meantime.
That's right.
yeah, but CE Broker is free. You don't have to pay for it, correct? And second is, you saw what happened when we went the other way. We had 700, 800 people that never took CE, so, or more, correct?
I mean, I think you probably
So-
still have them. They just upload coupons
Yeah,
and
you
news
can-
articles.
Then we need to, then instead of 25, we need to do 25% of the licensees to be audited every year. So every
So-
4 years, you can get audited.
Well, then you should.
So do you
Then-
think we should come in and help with that?
I don't know about the hell. I just gave you the hell outline. I don't know about the
I know,
hell.
but you know,
25%, I'm serious.
We
If you're
have-
gonna do coupons, we got.
we have really limited people here, and if we keep piling stuff on them because they're our staff, we need to pick a day and come in and help, and I'll pick a Wednesday. Which day would you like?
The question,
Realistically, at this point, we audited 50, which was 0.5%. I think.
Not even, it's 25 dentists, 25 hygienists, so it's.
Oh,
So
Yeah,
very minimal.
what I want to get to is a 5% flat audit every year. 5%.
Well,
1 out of 20.
so every 20 years, you're gonna get audited.
Maybe.
Maybe.
maybe not. Maybe you might be luck.
Well, that's
maybe if I
average.
did it 2 or 3 times in 10 years. But
But then when if you knew that your audit was coming more often, and as long as CE Broker is a CE Broker, it is very organized, it's easy to do, and you have that option. So then I'd be like, if it was me, I'm like, score, I have all this, already online, audit me every year.
Well, let's
That's
start out
fine.
with something easy.
But then
Yeah.
for the people who are older, less technical or whatever, did you have the option to continue on paper or however you maintain your CE and you get audited and you have to send your items in? I mean, it's.
Back to the checkbox.
Correct.
But the truth at this point is that all us older people have learned to subsist with CE broker, because we've been doing it now, what, 3 years? 3 years. So really at this point, the techno-dweeb, which is what I am, I don't get that off anymore because I haven't been doing it. But my only problem was like, I hated for that third party to have control over my check mark.
Yeah.
Correct.
You
And
know,
what
what happens
happens
when it
when
doesn't become
CE
free?
broker is no longer CE broker and somebody comes
Yep.
in and buys it, or then
Right.
it's,
And then we're gonna have to deal with it.
okay, then it'll become,
But it's never changed. I mean,
But it's already been
but
solved.
that's today. I mean,
All right.
it's inevitable.
Well, I think we've had some good discussion here and talking about things. I think we called the question on the survey. We have a motion and a second. Dr. White,
Yes to the survey.
Dr. McElwain, yes?
Dr. Gray, yes.
Dr. York, yes.
P-Check, yes.
Talbot, yes.
Harry, yes.
Okay. And Michelle?
If a survey is the next step and you're moving forward, Alva would request participation in crafting the questions for the survey.
It's just a survey for the board. And certainly Alva's more than welcome to do a survey too, or we can do it combined. But I'm very comfortable with what I've written from a board perspective.
Why don't you take that, and if you suggest any modifications, we'll do it.
Well, we'll consider them.
Okay, yeah, we'll definitely consider them. I'm sorry. I just, I don't think Michelle is gonna make an unreasonable request.
No, I just, surveys can be skewed by the way questions are.
Right, and I've already, and Dr. Finn and I have already eliminated his bias. We went through there and took a pen.
But to make sure that the questions are neutral and don't lean people towards answers, I mean.
Right.
Well, let me ask you. So-
Yeah, and honestly, I miswrote one, and then Mary Beth called me on it because I accidentally had somebody, and I did not mean to, and so we fixed that. But you may think there's something else in here, and certainly let us know.
So,
Well-
yeah, if you could give us.
Well, we could do this subject to any requested modifications. How's that?
I'm sorry.
Let me also
We
make one.
can give her that subject to any requested modifications. And then, if there's any big deals, then I like to get this thing out.
Yeah.
Well, my other point is, when you say that Alda wants to review it, I get and respect that. My question is, are you going to get feedback from all of your paying members or from certain, a board within Alda? Or, I mean, what does it mean that Alda is going to review the
Your
questions of
legislative
Dr.?
people?
Yeah, I mean, my question is, what voices are you going to hear from when Alda looks at the questions that Dr. York and this board have just passed to be sent out to our licensees?
I haven't given it any thought, but I would first get the executive committee to look at it with me, and then I'd probably get the council on legislation.
Yeah, I think that'd be good.
Okay.
I mean, but our goal would be just to make sure that the questions we're asking are neutral and give us all the best information that we can get.
Yeah, so
Okay.
not biased.
Right,
Okay.
right. Because we all know you can write a survey that gets answers and pushes people towards one way, and you didn't even mean for it to be that way. I mean, it just was, because surveys are difficult. They aren't always accurate. So
Well, yeah, I mean,
we want it to be the best information we can get.
right, I've run enough campaigns that you use push polls, and you let me ask you the right questions, and I can get you to vote for Adolf Hitler.
Right, right.
So, yeah, okay.
So I mean, just if we could,
Why don't y'all, can y'all work on that in the next week or so and get that back to me? Okay, that'll be good. Thank you.
Okay.
All right.
One quick thing, and not a big change, maybe no change, but I wrote in here approximately 90% of all of the states. That is now 94.5%.
I know.
So I'm perfectly fine leaving it 90% because I've already written it, we've already voted on it, so it's not changing.
So that could be something that Alda can update for accuracy.
We may be changing it anyway, so I say let's get it correct.
Yeah.
Okay, all right, okay.
Okay. All right. All right. Would you like a break? Dr. Piszczek needs a break, 5 minutes.
Oh, wow, you're getting some stuff done. I like it, Mark. Okay, how long?
I ain't gonna let you talk too long. I'm not gonna let you talk too long. I'm gonna keep you moving. Plan as signed, Dr. White, second by Dr. Gray. All in favor? Unanimous consent. And make sure there's no grammatical problem or spelling or.
And
I asked Dr. Finn to look at mine.
Cameron's gonna look mine over since it might have some legal ramifications.
All right.
Okay,
He
so
said
we're
he
not
would
gonna
look that
vote
over.
on it for this month?
Well, let.
I mean, I'm perfect. I don't think there's gonna be anything wrong with it, but
When does it need to go out?
We'll just
Anytime.
To be posted when it's posted, ready.
Hey,
Sooner the better.
you know, as I deal with people, I get where I want to change my numbers. You know, I said 95% of people are ethical. I'm thinking maybe I got the damn number wrong.
maybe it's backwards.
5%.
Higher or lower?
I don't know. It depends on which day you ask me.
Is that what he got?
Yeah, depends on who I'm having to deal with.
I'm doing it, so, I mean, if you want to change it.
Yeah.
Okay, let's,
We have some changes that
Okay,
want to be made.
okay, here's the problem we've got. I'm not sure we got enough business to have to meet next month. Okay, because that meeting would be when, Dr. Fan?
2 weeks.
2 weeks from now, so I'm thinking we might just skip March, take a month off. And, then our next meeting will be in April in Florence. April what?
April 17th.
April 17th. And would that need to be a 2-day meeting, a Thursday afternoon and a Thursday evening?
I only booked Friday.
Okay, that's fine, that's fine.
We're
And
not,
where is it?
we're not doing hearings in Florence, so.
Okay, there'll be no hearings in Florence.
Correct.
It's at the Renaissance, which used to be the Marriott.
If you have to come all the way from Huntsville, you'll probably need a room.
They're supposed to send me, I blocked out 10 rooms.
Okay,
So, as soon as they send the portal, information to me, which should be today, I'll forward it to everybody.
All right. and if you don't get a room there, you stay with us. We got plenty of room. No chillings at home now.
So
You're
we,
saying it would be just probably one day?
Yeah, 1-day meeting, just the Friday in
Okay.
Florence. And we're gonna skip the March meeting. Okay?
all right, we need a motion for that, change the
Yeah,
calendar.
Try to tell people about hearings and stuff.
So I take a motion not to meet in March.
I'll second it.
Dr. Fishcheck, second. Dr. Gray,
Yes.
all in favor?
Aye.
Unanimous consent. All right, and what was the issue we were considering before I jumped in on that? Dr. Finn?
Newsletter.
Newsletter.
Oh, the newsletter. Let's table the newsletter till we meet in April. And that way it gives everybody a chance to modify everything.
Yeah.
And then we'll send it out after that meeting.
Okay.
Okay, so let's move down. Okay, oh yeah, I want to get it fixed where Ms. Thomas can go to the AADB conference. Because I didn't put her on the list, but I think that's a good thing to send her to.
So
Motion,
move.
second, all in favor?
Aye.
All right. Shay, you're going to, where's the meeting? Chicago.
You missed one. Reinstatement of permits.
Oh, we already done that.
Okay.
Oh, we did?
We did that earlier.
With
Cosmo.
Okay,
We
fine.
did, when Cosmo was doing it,
I
but
agree.
we knocked that out then.
Got it.
Okay, we're down to CE approval, Dr. Finn, Bay Area Dental. I read over that.
Yes, sir. They only have everything to know about third molars.
All right?
Yeah.
I probably ought to go to that.
So
It took about 25,000 on
do
mine.
we,
Their meeting, they have a great little meeting.
Okay. A motion?
I'll make a motion.
Motion by Dr. Fischcheck, a second by
Second.
Dr. Talbot. All in favor?
hang on, one second, just because
CE?
yeah, I looked at, I looked at it and it had like, and I'm not saying we don't approve this, but do somebody have what they presented to us that we're voting on, just to,
It's the page in front of it, on page
what's the page number?
6.
66, okay, hang on one second.
Yeah,
I
that's
looked at it
it's
and,
not Dr. Zeman.
It's recognizing dentition, says recognizing symptoms, recognizing when surgical extraction is indicated.
It's on the back of that, on the right hand.
okay, yeah, and this is, that's fine, it looked, I mean, there's 3 discussion points on it, which is fine. You said,
Matt Zeman is a LSU graduate, oral maxillofacial surgeon, is board certified, that's going to be giving it.
okay,
So I actually spoke with him and his dad, Greg.
so you got a broader perspective. Oh, you see what I'm saying? When I just have that, and I'm like, wait,
Yeah,
what?
I should have said that I talked to them, and it's a nice presentation.
Okay, then that's fine. I'm all for it.
All right. Have we voted?
No.
Okay.
First and second, we haven't voted.
Okay, all in favor?
Aye.
Unanimous consent. All right, now we're down to approval of reinstatement and recredentialing, a board discussion for dental hygiene licenses, wanting reinstatement that are greater than 5 years but less than 10. I kind of had an epiphany talking about this thing. I would like to engage, what are the 2 places that you can do junior college dental hygiene? Wallace State and Calhoun, and then there's Fortis. I think we engage those 3 programs and ask them to help us come up with a 6 to 8 week remediation program for this problem. And our requirement would be that you take the 6 to 8 week remediation program at one of these places, and then we have them take the ADEX. And we don't make it easy. We make it where we know that they're ready to go.
Question, what are you gonna do with these 2 individuals?
Well, I didn't talk about that yet. I'm talking about the future.
Okay.
So in the,
It's gonna do the 6 to 8 week program. Where are we gonna?
It'd be one of those 3 providers I mentioned. Fortis, Calhoun, or Wallace.
Okay.
We could, they all 3 could have a program. I just think that if you've already got.
To get that together. You know what I'm saying?
Yeah, I mean, I don't know. For the dental hygiene injection, it took about 6 months. At UAB.
Or let me ask this, since,
I was just making a suggestion. I
Yeah,
don't know if that's
yeah.
a good suggestion or not.
So I don't know how many people in the future that's going to account for, but is it going to be worth their time and money to do that? I got to thinking about that last
I
night.
don't know, John.
Yeah.
That was a question I had in my.
Yeah.
If you only got 2 people every 4
Yeah.
years, is it worth even?
So instead of reinventing the wheel, is there someone out there?
yes.
There's credits, but
ADEX, CWC, ADEX and testing can
Do
do
they
it.
have a program?
and credits
I
has
think
one.
there's a lot of
There's
questions
expensive.
to ask on an individual basis. I think let's just use Emily. Emily moved out of the state. She couldn't keep her license up, but has she done anything since?
No.
If no, then okay. But what if it was this other one and just say, because I don't know either one of them, what if she was still inside a dental setting, but decided she was tired and burnt out and she did assisting for a while and just didn't keep her license? I think there's a
I
lot
think
of
that's
questions.
totally different, right?
Right. So I think we need to know what the circumstance is. And I don't know how
All
to
right,
do that and
well,
stay consistent.
all
I just
these
think
two
we need to know
people,
Neither one of them have practiced at all. One was a stay-at-home mom, and the other one was a, real estate or something, but
Yeah.
they had not practiced at all.
Sorry, let me make 2 quick points. I'll try to be quick. Number one, when we reinstate them, no matter what training they go through, however that lands, so be it. I have a problem that the board that we would charge them money to make up the years that they would have had a license when they didn't have it in the first place. I can see paying for the new one with an extra reinstatement fee. I have no problem with that, and I think that's appropriate. But I don't think we should charge them for 5 years of something that they never paid for and didn't get. I just don't, you know what I mean? Because we're back charging them for something that they never received. And I don't like that component of it. I do think a reinstatement fee is fine, even if it's a significant portion, because it is work on y'all, and that's totally appropriate. My second point is, look at it and what do we do with the dentist that quits practicing for 5 years? Or I know they don't go back to dental school. So I'm trying to be consistent with.
We make them do the CE, so they have
Okay.
to do 100 hours of CE
Okay.
in order to come back to work.
So would it, just to keep it simple, well, why wouldn't hygienists be any different? Why would they have to go back?
They have to do 60,
Yeah, but-
yes, right now.
Yes, but why would they have to do a remediation program when the dentist doesn't have to?
The rule says something like, at your discretion.
Yeah.
Yeah.
We're
So we
giving
have
it to your
And our
discretion now.
point was clinical skills are perishable.
Well, I agree, but wouldn't that be true for the dentist too? Wouldn't they need a remediation program for the same logic? I mean, I get CE, take all that, pay the reinstatement fee, but why are we going to have a remediation program for a hygienist getting reinstated that's been out of dentistry for 5 years, and you wouldn't do the same thing for a dentist?
I would.
Okay, well, I'm just saying it needs to be.
My thing would be that if you hadn't done anything, these skills are perishable.
I agree.
And I can tell you, if you don't use them, you lose them.
Yeah.
And so before a guy got back to doing, I'd want to know that he was clinically competent.
That's fine. Yeah, then we
I think
need to.
treat them the same.
Yes, that's all I'm saying.
Okay. I'm good with that.
And I don't know how many hands-on classes are out there, but I do know that there are some, and maybe instead of going through a big, long, expensive program, they can take a hands-on course.
So
It's just a few days.
y'all said credits and ADEC has a remediation program.
There you
All right, so we require them to do one of those and then pass the ADEC exam.
Okay,
go. And make up CE.
I make up as the,
So they have a remediation program, or is it just a testing?
no,
Well,
How many days?
Dr. Finn, if they have a remediation program and the remediation program would meet the 60 hours of CE, I think those can be the same.
Yeah, I think that would.
we could, from the 2 links that Stephen gave us back in October.
Yeah.
The credits, it is they developed it for you. So we have to tell them what we want and they
Okay.
develop it. But it's pretty
Yeah.
costly.
The one they have is just if you
Well,
fail.
I'd be happy to work with Kelly and write what our requirements would be and submit it to credits and do the same thing with, does ADEX want to know that, or do they already have a program, Dr. Piszczek?
They have a problem. I don't know what they were.
It's the ones that failed the testing though, like,
All right.
Yeah,
doesn't, it's not for
one
us.
remediation.
Well,
Then they go with
probably
credits.
credits is our only remediation. So you and I, we'll get with Dr. Finn. Dr. Finn will tell us what we need, and we'll come up with what our criteria would be. A minimum of 60 hours of continuing education, coupled with adequate skill stations.
Yeah.
And then we would need to submit it to them and then they would give us a quote.
Right. Yeah, right. If they want to play, they're going to pay.
I mean, do you think UAB could do something like that for us?
Do they have a hygiene?
They used to have a hygiene program,
Well, they have,
but they have all of our
They have
instructors that are
ADHD.
teaching in ADHD. They don't have ADHD, I mean, they're instructors.
yeah, right. But I mean, if they do clinical days anyway, do you think they would?
I think we can ask them, but first let's get the one set up with credits. And then let's use the credits formula And we'll go to UAB and say, can you duplicate this? And if they can, then it'll be easier to do it here in town. But I think we got to come up with a solution to this.
Yeah.
I have one more question.
Yeah.
Well, and I think we can tell them that we are interfacing with credits to set up a program.
There you go.
They applied for this in September, and they were under 5 years at that point.
No, they were still over 5. They're at 7 now.
2019.
2019. Yeah. Both of them 2019.
And when they applied, they were 6.
Yeah, that's right.
5 and 10.
They have been on ice now for
Well,
about
6
6 months.
times 12 is 72 hours, so it'd be a minimum of 72 hours.
Ours say 60 max.
60 max.
That's what ours says.
Okay. All
Can
right.
you just
All right.
let
So
them-
I think Kelly and I will work with you on how to handle that. Is that okay with y'all? And then we'll tell them what our criteria will be for them to be able to reinstate a license.
Be fine.
It's gonna cost them. Dr. Littleton's question. So what was the question? I read
No, I
it.
got that. I got that.
Okay.
Let me see. Shoot, I had it in front of me. I actually called and talked to her about it, and now I have gone blank.
It's about locals.
Page 79. I'm sorry.
Talked to her yesterday about it.
You know, when you have a local tenant and they want you to get, I'm sorry, I'm jumping in, but I can tell you
Oh,
what.
go
they
ahead.
Please do.
They want you to get somebody that's PPO to take your place
That's right.
so they could file under them. However, if you can't find a dentist that is PPO, they can file under your
For
credentials for.
for 2 weeks, unless it's under an extenuating circumstance.
Yes, and then I think
And she
it's-
gave me an example
Yes.
of a dentist that had a really bad car wreck, and so he's
Yes.
out for months. And
Yes.
Blue Cross will let the new person come in that's contracted bill under the old person's contracted number with Blue Cross for, I think it's up to, is it 2 months in an extenuating
60 days,
circumstance?
60 days.
Yeah. 60 days, and they just wanted, Dr. Littleton wanted clearance from the board that we had no problem with that. I don't see anything.
I don't see where it violates anything.
No, I
So the
agree.
answer would be,
Keep going.
it does not violate the
That's right.
EPA or our rules.
That's right.
And
Yeah.
honestly, it does right the opposite. I think it protects the public. It gets the people that crowns
Right.
finish.
That's right.
So
Needs to be done.
we're having so much fun. We're down to the licensure. Dental license applications by credentials. Who gets to do that fun thing? Dr. Talbot, take it away.
Okay, I recommend the following for licensure by credentials upon completion of the jurisprudence.
All right. And the list that we have here, and motion,
Motion, so moved.
second.
Second.
A motion by Dr. Gray, second by Dr. White. All in favor?
Aye.
Unanimous consent. Now we're moving down to dental hygiene license application.
Licensed by regional.
Regional.
Okay, I'm sorry.
I
Dr. Talbot?
recommend the following for
Man, I
licensure
gotta
by
get another
regional
bit.
exam upon completion of this.
So moved.
Motion
Motion.
by Dr. White, second by
Second.
Dr. Gray. All in favor?
Aye.
Aye.
Unanimous consent. Pardon me, now we're down to Ms. Perry.
I recommend the following for licensure by credentials upon passing the jurisprudence.
All right. Motion
So moved.
by Dr. White, second by
York.
Dr. York. All in favor?
Aye.
All right, now we're down to regional examination.
I recommend the following for licensure by regional exam upon passing jurisprudence.
So moved.
So moved by Dr. Gray, seconded by Dr. White. All in favor?
Aye.
All right, now we're down to break. I'm not giving y'all one. All right, we're to enforcement, my favorite part of the meeting.
So we had a question. We wanted to know whether or not you guys wanted to do the CRT discussion portion in executive session and come out and vote on all of the matters. Which would be the
Case review.
I prefer, is this a discussion? That's what I say.
Wait. Is there a reason, Cameron?
Yeah, well, it is the same thing, like, and I think I talked about the wire about it. Y'all really don't have, I didn't see an issue the way you're doing it, but is always potential. Like if you're giving too much information out about someone, just for you to say, there's no charges, there's no problem calls here, can that have an adverse effect on them? So that's the reason why some boards do it that way. But you don't have to, because you do redact it, so it's kind of more just up to you. That would be the risk of one.
I think as long as the board members understand that the redaction is protected and that the amount of information you give out should not be identifying, it should be small, that we continue the way we're doing it. I like that better.
I agree. And my main reason for that is that there's a lot of learning that takes place on what is and isn't okay and how the standard of care is evaluated by this board through examples, which this does over and over and over. And I think that's great.
Okay. And that would be the only thing. And it might just be something when new board members come on, understand just know that is why we're trying to keep it vague. That way somebody's not punished when y'all later find out.
I'm only concerned about it for the cases that we've gone back and revisited for, when you apply the, fines.
The matrix.
Yes,
Are you talking about for consent orders?
yes, I'm concerned about consent order cases, the previous ones.
Well,
Like when we're going back and rediscussing.
Right.
It's up to y'all. I mean, the vote has got to be in public. That's correct.
yeah, I mean,
But that doesn't have a name associated with it when we present it to the board, does it? It would be a case number still at that point. It would still be anonymous.
Yeah, yes.
but
I think those ones, though, that Dr. White's referring to have already been noticed. They already are.
Yeah, they've already been noticed.
they're,
Okay.
they're a couple, they're old.
Right.
Right.
Yes.
Well,
Have number, name, and
Right.
conflict judgment.
right. Well,
I think the idea of taking steps is probably better for us.
Or you can think about the situation.
well, I think anytime that we are in danger of revealing a person's name before we properly adjudicate something, we should go into executive session. I think if you're not
Yeah.
in danger of revealing a name, that we keep going like we're going.
The circumstance.
And that's how-
of the event.
Right,
That's right.
that's right. But if it is such an egregious and obvious problem, that just discussing it is gonna reveal their name, then we go into executive session to do it, to protect their good
I'm fine
name
with
and character.
That's fine.
Okay? Is that good for everybody?
Fair.
And that'll be just a.
Right. And I'll rely on you and Kevin to help us know when.
I got two that we got to say.
Okay. Is it on this go?
You can do that in Florida. I'm sorry. We're not gonna do any in Florence.
We ready to do them?
Let's go.
All right, let's start with you.
All right. Which number would you like me to start with?
25-178.
25-178 is a settlement judgment that's been turned in. This is a patient who had diabetes, a previous cataract repair. 25-178, no evidence is the same.
So move.
Moved by Dr. Gray, seconded by Dr. White. All in favor?
Aye.
Abstain. Okay, now we're down to,
Ms. Perry.
Ms. Perry and Dr. McElwain abstained properly.
And then
Okay,
25-204.
25-204, the patient alleged gross negligence in dental implant surgery. The patient was a licensed occupational therapist, about 50 years old. Sustained gross negligence.
So move.
25-204, Dr. Gray motions, Dr. White seconds, Ms. Perry and Dr. McElwain abstain. All in favor?
Aye.
Okay, unanimous consent.
25-207.
25-207 is an adverse occurrence. Here's my question. Or not, that we were informed when we licensed those offices, that they did not. And that we have cases now that show that they do. So, and this is the third case we've had that shows that. You know, we had the one out on 280, with the patient that awoke during the procedure, and they're treating physician was not there in the room. And when the treatment was all done, he came in and patted him on the back and told him, "Oh, you did really well." And she said, "How would you know? You weren't in here." So I think it's time to clarify that.
Would that be a letter of concern or clarification?
First, I just want to answer the question.
Okay.
Okay, and on this, I find no evidence is the same. 25-207, no evidence is the same.
So move.
There was no negligence.
Second.
Second, move.
You're on 25-122.
25-122. This involves 4 mandibular implants. Basically, this was sedation done with 10 milligrams of Versed over a pretty good period of time, copious local anesthetic, really an uneventful surgery. That was on the 21st. By the 26th, I think the patient had some wound dehiscence, which causes fairly severe pain. And the patient, because of the pain and not taking his blood pressure medicine, had a hypertensive crisis and ended up in the emergency room and admitted. While he was in the hospital, because he was sore and swollen, they treated him like he had an infection and gave him Vanc and then Clendon Percocet on DC. But really and truly, he had a wound dehiscence. And that's what the problem was. The implants had no problems. This adverse occurrence has no evidence to sustain.
So move.
It's 25-122 by Dr. Gray, second by Dr. White. Ms. Perry and I both abstain. All in favor?
All right.
All right.
Before we move to the next person, we have those 2 matters from previously that Dr. Bennett brought one to our attention. We wanted to discuss 22-108, that consent order was due to finish. They advocated for removal of probation for that gentleman, for that licensee.
Yeah. Okay.
Do you want me to have that prepared for next month
Yes.
or April?
April.
April, yes, I will prepare. It'll be 22-108 for April. And then we have the licensee who failed their CE audit, and I just wanted permission to open an administrative case.
Please.
Dr. Bennett had 2, right? 22-108 and one was 11.
I don't think he asked us to do any action.
Correct. He said that the audit person was doing very well, but he didn't reflect anything specifically. It was 22-68, but he had.
Yes or no action.
Okay,
All right.
That's old business.
All right.
Dr. White? Yeah, 2,
Yes.
that's all right. Let's do 150, or 25-151 first, please.
Okay.
What's that number?
Case number 25151. Patient also questioned the methods of performing oral cancer screening using oral ID. Again, the notes reflected that they did the treatment, and I see no evidence.
151. 151, no evidence to sustain. Do I hear a motion?
So
25, 151, do I hear a motion?
moved.
Moved by Dr. Gray, second by Dr. Talbot. Dr. White and Ms. Berry abstain. All in favor?
Aye.
Unanimous consent.
And then we have 25206.
Okay. Case number 25206. Patient complained of not receiving desired treatment while patient wanted a dental cleaning and was told he needs perio and root planing. The office informed the patient in February of the new procedure involving periodontal probing was required for any service. The patient states they were denied the service based solely on decline in the treatment. The doctor's response: patient had been told. Patient has been a patient of record since 2019 and was advised on the first visit of the need for full mouth probing. Patient also refused on 4 follow-up visits. On 9/26 of 2023, X-rays showed evidence of bone loss and probing depths were needed to diagnose. Patient again refused. Patient returned 6 months later and refused again. After reviewing the chart, prior to this, the office reached out to the patient to let them know that perio charting would be required at their next appointment. And the patient told the office that they would find another provider for his continued care treatment. After reviewing the records, chart notes, x-rays, including text messages to and from the patient, I see no evidence to sustain.
And this is 25206. 206, no evidence to sustain. Do I hear a motion?
So moved.
So moved by Dr. Gray, second by Dr. Piszczek.
Kelly and White.
Dr. White and Kelly abstain. Gosh, that's hard to say. All in favor?
Aye.
Aye. Okay.
Let's take care of
Unanimous.
top row. Dr. Gray.
Okay, all right, I've got 25208. This was an adverse occurrence self-report. In November of 2025, patient presented to a clinic for an extraction of tooth number 31. Local was given within normal limits. Tooth was extracted without complications. Patient then became unresponsive for 2 minutes after the procedure was complete. EMS was activated. Patient became responsive shortly after that. The fluids were started. Blood pressure dropped somewhat, then became normotensive. Then it came out, and the wife stated that syncopal episodes were common with the spouse, which was the patient. So they went ahead and sent them, EMS took them to the hospital to check everything out. Sure enough, it was diagnosed as a syncopal episode. Called and checked on, the dentist called and checked on the patient later that day and the next. Everything ended up fine. It was extremely well documented. There's no evidence to sustain.
This is
25208.
25208, no evidence to sustain. Do I hear a motion?
Motion.
So moved by Dr. White, second by Dr. York, with Dr. Hope Gray abstaining and Kelly Perry abstaining. All in favor?
Aye.
Unanimous.
Okay.
You have the
Unanimous.
old bill one too.
Yep. So we've got, I think this is 25127. Is that correct? All right. So this is related to a previous case where the hygienist was practicing without a license, and that hygienist, it was with an expired license. To be fair, they received an NDF. There was another dentist that was originally on the supervising dentist at that time. Turns out that this was part of a corporate entity, and so that dentist is not the actual employing dentist as the rule would read. And so that case was subsequently closed. In this case, 25-127 under the old rule, which basically ties the allow the dentist who employs a hygienist that has an expired license is held responsible in the same manner that the hygienist was. And so therefore, I'm going to recommend a non-disciplinary fine for the employer dentist, who is different than the supervising dentist in this case, based on our board rule.
Okay. And the case is?
25-127, non-disciplinary fine recommended.
127, a non-disciplinary fine of $500 by Dr. Gray. Do I hear a motion?
Motion.
So moved by Dr. White, second by Dr. Talbot, with Dr. Gray and Kelly Perry abstaining. All in favor?
Okay.
Unanimous.
All right, Cameron, while we're on me, do we want to go ahead and do the what are we calling it? Settlement agreement?
Settlement agreement and consent order. So I've talked to some of y'all how I've developed this, trying to craft it based on what y'all said, how you handle it.
Hey, one clarification before you do that is when we wrote that matrix, like if it went to, Kevin, explain so I say it correctly.
So the matrix as it states now, pass these out first, talk and work. The way that it states now is that if you have negligence and there are aggravating factors, you can go up the food chain, so to speak. And on the first rung of it suggests that baseline negligence would be $1,500. But what we need to interpret is that means 0 to $1,500.
Yep, up to 1,500.
And then if the person goes to tier 2, that would be 1501 to whatever the value is.
That's right. And that's the way I read it, y'all, when we did it. So when it starts, it's $0 to $1,500.
Correct.
And then it's 1501 to 2,000.
Yeah.
Then it's 2001 to 2,500.
Oh, okay.
We built a matrix like that.
Yeah.
That's the way it was intended, just not solid numbers.
But there's two other clarifying points. One is that sometimes, like on a fraud count, the money will lessen as you go up because there's the requirement or the desire to have a revocation or a status change attached to it. So just be cognizant of that.
Okay.
Sometimes the money comes down because the penalty becomes more severe on the revocation or less.
Wait, explain that again. I didn't follow that.
Just a bad example, but I think it was the fraud statute where it said that if you committed baseline fraud, it would be like $3,000. But if you
That's what the matrix said. Statute says caps up to 5,000. We're getting a little bit more granular. Okay.
yeah,
All right.
The next level of that was like fraud with whatever restriction to it. I think the matrix said that you could go up to $2,500.
Okay.
They also wanted you to put the person on probation or suspension or something to that effect. So there'd be an actual license switch with a lesser fine.
So the number, the amount, the monetary fine goes down, but the status of the license is changed, which is the reason, that's actually more severe. Okay.
Just so that we're all aware of
And
that.
that helps me whenever y'all, when we start getting these things rolling in a different way going forward. If you want to get the minimum number or max, or if you just want to say, look, this is
Follow the matrix.
follow matrix. Figure
Right.
that out.
And then that way we're all on the same page, no matter what we do.
Yeah, all we really need is for you to tell us, I want to notice this person for a hearing. I want it to be this specific charge, this count, negligence, fraud, whatever. And then if it's a baseline one like negligence, please let us know if it's a tier 1 or a tier 2, so we know where to start the negotiation process. And then if it's something more granular or severe, direct that.
And ideally, I'll have that worksheet,
Hopefully in April.
figured out in a way where it's just y'all marking.
Okay.
You present it here, then you give it to us, and that way I'm not constantly having to bob back and forth.
So where are we, Hope?
Okay. All right. So we've got this one I was having to catch up on. This is 2 consent orders, nuts and bolts of this. These are partner dentists that had 4 hygienists in their practice. Longstanding hygienists had been in good standing with the board for year after year. They all went to renew at the same time, all 4 hygienists. Something glitched either in the system or on their end of the payment. Long story short, none of the hygiene licenses renewed. All 4 hygienists have subsequently been penalized with a non-disciplinary fine for practicing with an expired license of $500 each. Both dentists have already had a non-disciplinary fine of $500 each for employing hygienists without a license. Since it was multiple hygienists, the NDF covered one of the hygienists, but we're left with 3 others. So the nuts and bolts of this are each of these consent orders consolidates and adjudicates the other 3. Cameron and I have negotiated consent order with them, and I made it a $150 consent order for the other 3 because my rationale is that they've already paid $500 between the hygienist and the dentist. They paid $3,000 already for this, and I thought that was more than appropriate. And this was really all wrapped into the same issue. The fact that it was 4 instead of just 1 just happened to be because they all ran through the same gambit, and it resulted in a group of people. And I thought that was fair to do a settlement agreement for $150 for each one of these dentists for allowing the hygienists 2, 3, and 4 to practice without a license. It should be noted too that as soon as they were made aware of this, which was 7 days after their hygiene license expired, they became renewed and reinstated in good standing within 24 hours.
All right. Motion to accept the consent orders as recommended by Dr. Gray.
Yeah.
Okay. You should probably raise the numbers.
Read the case number. Case number 25128,
25128 and
2543.
2543. Do I hear a motion?
Motion.
So moved by Dr. York, second by Dr. White, with Dr. Gray abstaining and Ms. Perry. All in favor?
No, just those run.
No, is that wrong?
Yeah,
The discipline's all on the dentist.
yeah. Well, the hygienist got this one
They're already
previously.
been got.
Yeah, and these dentists have already been gotten with the NDF.
So we'll get them again.
So good.
We need those to be initialed by the team leader, and then we need those.
And me?
You sign it.
Cover page with a consent order.
So in the way I did it, to just try to make sense of it legally and how we're doing it. It's once a team member gets all of the things for a notice and what they're allowed to set up on the front end, me and him are working together. We get the agreement. It comes before the board, technically.
Yeah, you gotta sign it. It's President's execution.
It allows the board to look at it and say, all right, I saw the agreement, and then you execute. So I'm just trying to make, and I'll put a little bit more information in the settlement agreement with them.
I gotta sign it.
The rights of the state like that.
Yeah, tell me about that one real quick. We probably been over it, and have I gone blank on it, or did we?
There were just 3 that were due. I forget in the licensing.
So this is case 25209. This is the one that
Wasn't yours necessarily, but I thought the entire board would want to see all of it. This is Dr. Talbot's case.
Oh, that's why I didn't make that. Okay.
I don't know if you want to present that like Paul just did, or if you don't, I'm more than helpful. Welcome to do it.
Yeah, Dr. Talbot had a renewal case, and this person fell into the cycle where they were noticed for a hearing because they already had some suit NDF. As a result of that, Dr. Talbot got on camera and dictated the terms 56. I think it was. It's $500. The licensee had counsel reviewed the agreement, co-signed their portion of the settlement agreement as well. It just needs to be initialed and signed by Dr. Talbot and Mr. Elkins, and then the board will vote on that, and then Dr. Wynn will sign the consent order portion and take care of that. If you want to vote on that, or if you want to look at it first, that's fine, but if you want to vote on it, it is case number 25209 for the consent order.
Dr. Talbot, what do you think? Okay. Dr. Talbot would like us to approve the consent order on 25209. Do I hear a motion? Moved by Dr. York, second by Dr. Piszczek. You wiggle an ear. Dr. Talbot and Ms. Perry abstain. All in favor?
Is this a $500 consent order? Is that right? And it's for a dentist that employed a hygienist without a permit, without a license?
Yeah, this was supervising dentist.
Okay.
Unanimous? Unanimous? Yes. All right. We're at the top row is done. We're on the bottom row. Does Dr. Talbot have another one?
Nope, just that one for us.
Dr. Piszczek have one?
No more consent orders for the.
Oh, there none?
We're out of consent orders. Now we have more cases.
Oh.
And I will say, they can start trying to get all this implemented and get everybody, especially the attorneys and licensees, trying to get it rolling, it'll take time, but they're starting to move.
They're starting to move, and Cameron's done a great job on this whole process with Kevin's help.
Okay.
For sure.
I will say, if there's anything about the process that y'all want to change, I'm not married.
I think this is pretty smooth. I like this.
You are ready to take it to something. That's what that rank says, what that rank says.
Okay, so you voted on that, and you signed that one, so I need that one back.
Good sign.
Thank you. So the next case we have, you don't mind doing that one? Is the
Same.
205?
205. Okay, 25205. This patient presented to the dental office wanting to get a new denture on the top to replace his existing one and to get treatment planned for the lower arch. The patient told the office he had seen 6 or 7 other dentists to discuss his missing teeth and was very anxious about dentures not fitting well. The patient has severe bone loss on all remaining teeth on the lower. A week later, the patient still had many questions, so the office had the patient come back to address those issues. The patient was happy with the answers and the treatment plan and will call the office when he decides on treatment. 3 weeks later, the patient was scanned for an upper complete denture and lower transitional partial denture in preparation for a patient to get 2 implants on the lower for a snap-in partial. 4 weeks later, the patient returned for the wax try-in, and the occlusion was not correct. New records and scans were made. 3 weeks later, the patient arrived at the office expecting a try-in, but the lab requested a new scan due to missing areas on the lower arch scan. This was the last time the patient went to the office. The patient is requesting a partial refund of the money paid for treatment and stated there is no need for future assistance in regards to any dental work from that office. I don't see any patient care issues or safety issues in this matter. It seems to be a very anxious patient with high expectations. And when the try-in wasn't ready on the appointment that he was there, that he thought he was there for, and there was a need to rescan, the patient simply walked away. This is a financial matter, which we don't handle, and so I see no evidence to sustain.
So move.
Kevin, is this not in our financial matter? It's not in our jurisdiction, is it?
The financial portion wouldn't be, but John evaluated it.
Okay.
More than
For
just that
negligence.
lens. Yeah.
Okay. All right. So,
What it was apparently there's a lab out there. Can I say the name of the lab if I think I know it?
For not.
let's not.
No, it's a national thing. But anyway, apparently you do scans and they send you things back. And apparently they weren't happy with the scan. It just be kind of like missing the Richard Miller pad and 2 impressions.
Right.
And so that's kind of all that it was.
All right, so 25205 has no evidence to sustain for Dr. York's recommendation.
So moved.
Motion by Dr. Gray, second by Dr. White. Dr. York and Kelly Perry are abstaining. All in favor?
All right.
All right, I'd like to try something new, please, for Dr. Talbot's cases. I made a spreadsheet that I passed out to everybody. I have one for Kelly, one for Tom.
Thank you. Thank you.
I like that. It could be very efficacious.
It's almost like somebody asked for this before.
And then I think after this portion, Dr. Pishek wanted to go into executive session to discuss a couple of things. And then don't forget to do a conflict check. I have all of these folks' names, and I'm more than happy to say that. Do the notice portion.
Okay.
At that time.
Dr. Talbot recommends.
Yeah, I submit the following for the non-renewal cases.
So these are all non-disciplinary administrative fines?
No, sir.
No, some of them are notices.
Again, there's an administratively closed case. There are 4 or 5 NDFs on the tip top. And then there are a series of notices that Dr. Talbot has already given an estimated penalty for to Mr. Elgin.
Okay,
So all of the recommendations are.
okay.
Yeah, you
All
can
right.
say accept the recommendation.
Except for recommendation. So motion to accept Dr. Talbot's recommendation in bulk.
And Matt,
Dr.
I looked
Piszczek.
at every single one and all of these details.
All right. Dr. Piszczek motions. Do I hear a second? Second by Dr. White, with Dr. Talbot and Ms. Terry abstaining. All in favor? Unanimous.
all right. How you doing?
I like that way.
I got it.
Yeah, well, I think it makes it easier than doing the whole gray method.
Sorry, I guess.
I got exhausted.
Yeah, Pishek has cases. And he wanted to do a couple of them.
Oh, I asked him. Because we done it like this in the past.
Character and then say, however long you need, 15 minutes.
15 minutes. Can we do it here and turn off the?
And you certify that is,
Yeah, I don't have to certify, I'll get
oh,
it.
you don't? Okay,
And in litigation.
okay, all right.
I've got one quick question before we go in that this came up and just wells in my brain. When we send out notices and it says your case leader or your team leader, is it necessary, appropriate, or does it matter if the board member's name is or isn't on there?
Anything that you know, Kevin? I don't think it's.
We've never put the board,
Well, well,
Well, you've always put the team leader on because
Yeah.
the team leader, so logistically speaking, the team leader is the one who is making the allegation and presentation before the board. So ideally, that person would sit co-chair and be the subject matter expert in that case against the responding dentist. So that's why they're signing the notice. If that person has any reason, well, then you know this person in the case, or if you have other conflict outstanding, you'll just go through the simple refusal process, and then usually the president will.
pass it on to the president.
so my question is, is that legally required? Because if it's not, I would prefer to leave the name off, because what can happen is when you send out a notice, and let's pretend it has Dr. Renee's name on it, well, first thing that person's going to want to do is pick up the phone and call Dr. Talbot. And I don't know that that's appropriate, probably. You see what I'm saying?
No, probably not. The problem you're gonna come into, it probably won't be as apparent on the real cases, but on,
Oh, notice for standard,
case.
yes, standard of care notices, yes.
At some point, they're gonna be entitled that this is the board witness who said I reviewed.
They will know it, yes, I agree.
You can't just preclude them from ever,
No,
whether you put them on that form of notice.
something to consider.
But we always put the name on the notice, Kevin.
Yeah,
I have a question.
yeah, my name's been on a bunch of them.
I'm the newest member on the board, and my name is about to be on 200 notices. I'm supposed to be spreading positivity. I'm the positivity transparent.
You don't know about phone calls yet.
But they would know by the, what
Correct,
cases.
correct.
So it's the
Right.
same.
I'm aware.
Yeah.
Okay.
That's a board decision.
It's really, yeah, it's up to y'all. Like I said, my only point with, well, most cases, at some point, you're gonna know if you're the expert.
They will know.
All right, all right.
But other than
I don't.
I feel the same way.
Committee, the problem cost committee would.
We're gonna get there.
Yeah, that'll help that.
We're traveling. We're traveling. We got a lot of things to get in order to get there. And this matrix thing and the way we're doing it is getting us there. All right.
Mark,
A motion and a second on the floor to go into executive session. Let's have the roll call vote.
quick discussion on that. Just, is this the last thing on the agenda when we come out of executive session? Are we through? The reason I'm asking is because Michelle may not want to wait anymore. She's been here all day. If there's going to be no other business after this.
All I want to do is conflict checks after this, so my portion is completed after this.
You want a conflict check right now?
No, sir, I won't do that.
Executive session?
Y'all will have to vote on Dr. Duchesne's case.
Okay, all right.
Can't do that in executive.
Right, we have to come out and do that.
It literally be coming out.
All right.
Well, one other
Can we turn
thing.
off the TV and stay in here?
Yes.
But one other thing, just in case Michelle might want to hear this, I texted Dr. Melody Jones about the hygiene remediation thing, because I knew she was doing ADEX exams the day at UAB because I'm going Sunday. And so she asked, she's already sent me a link that is ADA CERP approved, and it's a dental hygiene refresher program. This one is 25 hours recorded online, 20 hours in person in Connecticut. It's $3,200. And so, we can still, I know that you and Kelly were going to work on this. Kelly, I'll send you this link for you to review. But I don't think any program can spend less than $3,200 on a person to get them remediated when they can go up to Connecticut and get this done. And this is remediation, getting them ready for the ADEX hygiene test.
Okay. Let's just be clear. You want a hygienist that's been out for 5 years, pay $3,200, a flight, hotels, 20 hours worth up there, so it's multiple nights in a hotel. We're looking at what, $10,000?
I'm not saying that's what I wanted. All I'm saying that's what she said. That's just what she sent back.
I just don't know
Yeah.
if you can find something at home.
We can, but not, it may take
Not
6
in
months.
Yeah.
Period. They've been out 7 years.
Okay, that's what it is, then we're.
Yeah,
They're
I
gonna
guess
wait
you-
6
if
to
they
10
have a
months.
choice, I mean, if they
Well,
want to
well-
get it immediate, then they have.
We can,
Yeah.
we can offer this as
Yeah.
an efficacious way to do it,
Yes.
but if they don't want to do this, we can tell them that we're going to create
We'll
a
look
better
at
way
something.
to do it at
I
home.
agree.
But
This
it
is
might
good
take,
for
but
now.
it might
Right.
take 6 months to create.
Yeah.
I like this.
I
I
mean,
sent
I
it to
think
you.
this is good for now.
I sent it to
For
you.
You got it?
Yes.
I sent it to both of them.
Okay.
Who was the first and second?
So in executive session.
Oh, yeah. Fischcheck and Dr. White, and let's have a roll call vote. Dr. White,
Dr. White, yes.
Dr. McElwain, yes. Dr. Gray, yes.
York, yes.
York, yes.
Talbot, yes.
We can
You're good.
All right,
Davey does that.
you ready?
Did you see that with your sister?
On case 25-104, no evidence to sustain.
All right, 25-104, the recommendation is no evidence is sustained by Dr. Piszczek. Do I hear a motion? Motion by Dr. York, second by Dr. White, with Dr. Piszczek and Kelly Perry abstaining. All in favor?
Aye.
Case 25-155, no evidence to sustain.
25-155, no evidence to sustain by Dr. Piszczek. Do I hear a motion? Motion by Dr. White, second by Dr. Talbot. All in favor?
Aye.
Dr. Piszczek and Kelly Perry abstain. You're gonna get to be a doctor if I keep going. All right, next.
25-167, we need to close this administratively.
25-167, administrative closure. Do I hear a motion? So moved by Dr. White, second by Dr. Talbot. All in favor?
Aye.
Dr. Piszczek and Kelly Perry abstaining.
25-170, we'll let the board go to the AG's office for concerning this case for approval.
Forward to the AG's office.
Yeah, we need to forward this to the AG's case.
All right, motion? So moved by Dr. White, second by Dr. York. All in favor?
Aye.
Abstaining, Dr. Piszczek and Kelly Perry.
25-173, recommendation, no evidence to sustain.
25-173, no evidence sustained. Motion by Dr. York, second by Dr. White. All in favor?
Aye.
Dr. Piszczek and Kelly Perry abstaining. All right. What else we got to do?
That's it for me.
All right.
One quick question, hopefully not a long answer. The one thing that was asked more than once last weekend too is about temporary hygienists that kept the 1099s. Have we done anything with that as far as researching that or?
The 1099 or W-2 issue is not our problem. That's a federal tax problem. It's not our problem.
Right.
The only thing we can say at this point is that we require direct supervision. And requiring direct supervision, if anybody asks the IRS, says that you can't be an independent contractor and require direct supervision.
Correct.
So it cannot be a 1099, but that's not our problem.
Gotcha.
That's federal tax problem
Here's,
and state tax.
let me ask,
That's outside our jurisdiction.
Yes. And then, if a dentist 1099s that employee or that employee, is requesting 1099, the burden of the fine penalty comes to the dentist.
Right.
So, and then if there's any question, I think there's a form that can file and let the government determine whether or not you're truly 1099 or W-2. But it's going to come back on the dentist in the state of Alabama.
Do not pay Social Security tax on somebody. You will find out as they get older and when they file something, they'll be back on you like a June bug. I done been there and got a t-shirt.
Right, thank you.
Look, take it from a man who runs a cotton gin that I got ginned really well. I have no lint in my navel. And that's exactly what happened. Okay. Well, it has been most enjoyable being here. We will not have a meeting in March. We will meet in April in Florence, Alabama. And Dr. Finn will forward to each of you the room block. And I look forward to seeing y'all up there. I'll try to arrange maybe a corporate meal on Thursday night, somewhere nice, so we can enjoy each other's company. That'd be a good reason to come on over and stay, John.
Yeah.
Like I said, if you have any difficulty with the room, all you gotta do is tell me. I got lots of rooms. Okay, you can stay with me.
motion to adjourn.
It's probably nicer anyway.
Oh.
I know.
Well, I mean, we gotta do eight rooms to get the block. And that helps on the room too, don't it? Price and everything. Okay. And it should not be a particularly long meeting, I would think, but since we skipped one, we never know.
I've got, catered breakfast.
Okay.
So, I mean, that, you either pay for the room or you pay for the breakfast.
Yeah, one or the other. And it ain't cheap, but it'll be nice. It'll be a good breakfast. For those of you that went to the 360, y'all want to do the 360 again, or would you rather go somewhere else?
360.
360 is a rotating restaurant that looks out over the Tennessee River. I thought it'd be kind of fun.
It's real nice.
It's very nice.
I'll make arrangements.
But he's not telling us the whole story because he's going to narrate every degree. That's that's Florence.
I'm gonna tell you where as we go. We'll enjoy it.
He's going to tell us everything about the history about what Wilson.
I can tell you all about Wilson Dam. Connie's granddaddy was the cement contractor.
That's so cool.
Yeah, he lost two people. They fell into the damn thing, and it's a continuous pour down. You know, it's the dam never cured before they poured the next thing, so they were always pouring and forming, and they lost two people in it.
Wow.
I've been waiting for them to bubble up, but they hadn't yet. They finished the dam in 1924.
When we did the Hoover Dam tour, they said there's parts of that that still aren't cured.
Oh, no, that's like, you know, people forget Wilson's 100-foot dam. It's an incredible dam. It's able to supply power to about somewhere around 150,000 homes. I mean, that's pretty big if you think about it.
All right, motion to adjourn.
Motion to adjourn, second. All in favor? Thank y'all.
Thank you. Can you sign my?